Hello everyone, my name is Yiran Xu, and today I'm excited to share my project on pet therapy for AD patients, enhancing quality of life. This topic is interesting because it shows how the simple act of interacting with animals can bring real benefit to people with Alzheimer's disease. So, what exactly is pet therapy? Well, it's also known as animal assistant therapy and is when trained animal and their handlers spend time with patients to help them feel better, reduce stress, and boost their overall well-being. You'll often see therapy animals like rabbits, dogs and cats, and even horses being part of the sessions. The activity can range from petting and feeding to walking or just being around the animal. Next, let's look at the main goal of pet therapy for AD patients. First, pet therapy provides emotional support. Spending time with animals help reduce anxiety and depression, making patients feel calmer and less alone. Second, it offers cognitive stimulation. Simple tasks like feeding or grooming a pet keep the mind active and help maintain memory and attention. Third, pet therapy encourages physical activity. Activities such as walking or playing with pets motivated patients to move more, which support better physical health. These goals work together to improve the overall well-being of AD patients. And here is a quick fact. Studies have shown that spending time with therapy animals can reduce behavioral and emotional issues in dementia patients by 20 to 30%. Now, you might be wondering why choose pet therapy to support AD patients. First, pet therapy brings big emotional and psychological benefit. Spending time with therapy animals has been shown to lower stress and ease anxiety and depression. Regular time with animals can improve mood and bring more emotional stability, helping patients better manage the challenge that come with AD. Second, pet therapy helps with behavior as prevent to reduce common symptoms like aggression in AD patients. The calming presence of friendly animal can have smoothing effect, making patients feel more at ease, which improve their interactions and overall quality of life. Third, there is the benefit of non-judgmental companionship. Animals give unconditional love, which can be really comforting for people dealing with cognitive challenges. This kind of support can boost self-esteem and help reduce the stigma that comes with Alzheimer's disease. Fourth, pet therapy boosts social and cognitive engagement. It encourages patients to interact with caregiver and others, reducing feeling of isolation and promoting a sense of community. Activities like feeding or grooming the animals also engage cognitive functions, help keeping the brain active and stimulated. Finally, physical activity and motivation are key benefits of pet therapy. It encourages increased physical movement by getting patients involved in activities like walking, playing, or even simple exercise with animals. This helps keep them active and promoting better health. Plus, having a routine with pet-related tasks help establish a daily structure, make it easier for patients to stay motivated and engaged. Now, let's talk about the mechanism that's behind the pet therapy to help AD patients. First, it has biological benefits. Spending time with therapy animals boosts oxytocin, the love hormone, which helps reduce stress. It also lowers cortisol, the mean stress hormone, making patients feel more relaxed and stable. Second, pet therapy provides brain stimulation. Studies show that interacting with animals can activate brain areas that link to pressure and social behavior. It even supports neuroplasticity, helping the brain form new connections, which is great for cognitive health. Third, it helps with emotional balance. Animals create a calming presence that reduces agitation and increase serotonin and dopamine, the feel-good chemicals that improve mood and motivation. Lastly, pet therapy boosts social and cognitive activity. Animals encourage patients to interact more with caregivers and others, and tasks like feeding keep their memory and attention sharp. While pet therapy has a lot of great benefits, it's important to know the potential challenges that come with it. First, patients' response can be different. Not everyone is comfortable around animals. Some patients might feel scared or uneasy, and there always a possibility of allergies to animals' fur or dander. Second, animal welfare need to be considered. Therapy animals should be well taken care and not overworked. They need proper training so they can handle different patients' behaviors safely and calmly. Third, there can be challenges in getting those programs up and running. Cat therapy need funding for things like training, animal care, and management. Plus, finding certified therapy animals and trained handlers isn't always easy, especially in certain areas. Lastly, hygiene and safety are super important. The animals need to be kept clean and healthy to prevent any spread of germs. And there's always a small risk if a patient or an animal acts unexpectedly. Even with those challenges, being aware of them helps in planning and managing pet therapist program better, making sure that both patients and therapy animals can benefit in a safe and supportive way. As we look ahead, there are some exciting new directions for pet therapy research that could make it even more effective and accessible for AD patients. First, we need more long-term studies. We know the short-term benefit of pet therapy, but long-term study could show us how well these benefits last over time. Tracking cognitive changes in patients who get ongoing pet therapy can give us a clear picture of how it might help slow cognitive decline. Second, it's important to explore a wider range of therapy animals. Right now, most programs use dogs and cats, but researching other animals like rabbits or birds could help open new options. Targeted therapy to fit each patient's needs and preference could make it more effective and easier to assess. Third, there's a lot of potential in adding technology to pet therapy. Robotic pets or virtual reality could be used to create similar benefits to real animals interactions, especially in places where having real animals isn't possible. One effective approach is making data-driven adjustments. By using wearable technology, we can track patients' response in real time. This data helps therapy sessions to be better meet each patient's needs, make the treatment more personalized and effective. Lastly, having clear guidelines is important for the future of pet therapy. Creating best practice and clear rule will help make sure it's done safely and effectively. More training and certification program for therapy animal and their handlers are also needed to keep the high quality of caring. For this project, I look at some important articles that help me understand how pet therapy works for AD patients. Overall, the research showed that pet therapy has emotional and behavioral benefits. It helps improve mood, reduce restlessness, and encourage social interaction. One helpful study was by Bernabé, which gave a good overview of animal-assisted therapy and its positive effect on people with dementia. At the same time, I also found that Fei-Lian and Llewellyn Jones' study in 2006 really interesting because it explained how pet therapy works in body, like how it releases oxytocin in lower stress. This shows me why the pet therapy makes patients feel calm and happy. Some articles were useful but had limits. For example, Perkins in 2008 focused on dog therapy and shown that improved mood and social interaction, but it was done with a small group, so the results might not be applied to everyone. And those articles helped me put together in this presentation and shows how pet therapy can really improve life for AD patients. Thank you so much for listening. I hope this presentation gave you a good understanding for how pet therapy can help AD patients. I appreciate your time and interest in, and we would be happy to answer any question you have. Thank you again for being here. Goodbye.